Hi, my name's Phil. I'd like to talk about politics. In this video, I'd like to consider the prospects of the government's imminent actions doing anything at all to blunt the currently rising second wave in the UK. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, first of all, we'll consider the number of new cases and how many there really are per day, because the official figures are not the real number, not just because figures are fiddled in a particular way, but just because there are always going to be cases that we and even the government will not know about. So you have to consider the number of people testing positive per day. Obviously, in an ideal world, that would be the actual number of new cases, but we can't test everyone routinely. I know the government announced, Boris Johnson went on the telly and announced that we'd be testing 10 million people per day by Christmas, which effectively would be everyone in the UK per week, which would be enough to be able to test this. He's now since denied ever saying that, even though he's recorded saying it on the telly. But, you know, in the UK, we don't even seem to have the capability of even testing frontline healthcare workers and care workers routinely. Even in Scotland, where it's a lot better, and even they have not been able to meet that pledge yet. So the idea that everyone could be routinely tested is pie in the sky in any country, even where it's well run. So we need to consider some other things as first. Now, the first of which, straight away, is the fact that studies suggest that 65% of cases are asymptomatic. So what you need to do to convert our current 7-day moving average number of new cases per day, which at the point at which I'm doing this is 3,598. So you divide that by 0.35 and you get 10,280. So in reality, if we had a testing capacity that could meet demand and we were getting the same results, you'd be talking about, in reality, we have 10,280 new cases per day. But of course, we're not done there because we don't have a testing capacity that can meet demand. So another problem is that most people can't get a test when they need one. Now, here's where I'm just going to have to throw a number out there, because last week, the head of Test and Trace, Dido Harding, was facing MPs. At that point, the stats, which were released in her own paper, suggested that we were testing an average of 82,000 people a day. But there are about 750,000 not able to get a test. Now, that won't be 750,000 people a day needing a test and not being able to get one, because obviously if you can't get a test on one particular day, then you'll try on the next, so you'll be in the next day's data. So it's likely to be less than that. Now, I'm going to be generous here and suggest that about 30% of people needing a test are able to get one, whether it be a walk-in centre, booking a test, getting a test sent to them. So dividing by 0.3 now means we have about, or just over 34,000 new cases per day. Now, is that being generous? Are we actually looking at much more than that? What I will say at this point is, obviously I've just had to make up a figure there because I do not know what that figure is. But it is in line with what the Chief Medical Officer, Professor Chris Whitty, was suggesting earlier last week. He was talking about 38,000 new cases per day in reality, which essentially means that I have been generous, because not only is the figure I've come up with less than that, he was talking about this nearly a week ago, where, and we now know over this coming week, we've had a sudden upturn in cases as well. So we could easily be looking at 50,000 new cases per day, maybe more. So we are really into a second wave here, a really serious one. Don't necessarily look at the numbers and go, oh, it still seems manageable. No, because that's nowhere near the real figure. And there is another factor to consider as well, because the failure of our government in Westminster isn't just in not providing enough tests, but in stopping people even wanting to come forward for a test. So you've already got a lot of people who are coming forward for a test and can't get one. What about all the people who sort of should come forward for a test but are not doing so? Now, what would cause this? Because for all, you know, a lot of people talk about how Boris Johnson keeps following Donald Trump's lead. Well, there are times when you'd think Donald Trump should follow Boris Johnson's lead. Remember how President Trump always talks about the fact, oh, the numbers, the COVID numbers only look bad because we're testing so many people. we should test fewer people. Well, maybe he should have taken a leaf out of Johnson's book and encouraged fewer Americans to want to be tested. So consider three things. First of all, the public have lost trust in the government. We've known this for months, ever since the Barnard Castle. That credibility was gone. After it became clear that the government do not follow their own rules, they'll make excuses for their own when they break the rules. There's no confidence whatsoever there. Second, so you test positive, let's say. You get a test and you test positive. You then have to self-isolate. People do not like doing this, and they would rather not. But after reports of people who were supposed to be isolating and then not doing so, being directly linked to major outbreaks, very famously in Bolton, for example, where a holidaymaker had come back into the country, they were supposed to self-isolate, they did not. They went on a pub crawl, in fact. And then the pubs they went to have been linked to major outbreaks in Bolton. This is a very naughty boy, who you would hope will never have their name revealed publicly. And so there are going to be people that have no intention of isolating. Now the government have announced a £10,000 fine. They're now serious. If you test positive, you are isolating, which is fine. No pun intended. The problem is then, what you do is you create people, you don't create the people, but you create a situation where the people who don't really want to isolate will go, well, I don't want a positive test then, so I just won't go for a test. If they think they can manage it, if they're not super worried, they just won't get the test. And although you can and should blame those individuals for their selfishness, the fact is that to get people to behave in a certain way, we need peer pressure. We need that sort of community peer pressure. And it just isn't there to force these people to isolate because the public are not interested in following rules that the government do not set a good example for themselves. Then there's the third thing to consider. Now, there are some people for whom we may feel sympathy. Because, again, let's say you have symptoms and you think, well, I should go and get a test, but you need to work. Now, let's say you were to test positive. You'd have to isolate. For a lot of people, that means statutory sick pay. They're not going to get paid. They're off work. Statutory sick pay, which is less than £100 a week. You can't live on that. So these people cannot afford to be off work. And so you've got a group of people who will just tell themselves that it's nothing. Your brain is very good at fooling you. It's really good. You're really good when you need to. When you face a real dilemma, your brain is very good at convincing you to do what's in your best interests. COVID symptoms, after all, could be anything. They could be something that's not COVID. Most people who have symptoms and get tested, the test is negative. Of course it is, because the symptoms are only an indicator. They're not even strong evidence for having the infection. That's what you need to test for. And especially when you've got protections against evictions being removed, you are putting some people in the position of risking financial and social ruin. They don't have savings to dip into. They're not going to have enough money to get by. So the pressure is on their brain to convince them that they've just got some bug that's going around every year. There's no, and especially when you know that booking a test, most people who need a test can't get one. Again, you'll convince yourself, well, if I get a test, I'll just be taking it from someone who really needs it, because I don't really need it. This time of year, I always get a cough. So at just the time when all the public health experts are crying out for more testing, the government have actually created conditions that are indirectly, it's not a deliberate ploy, but indirectly are going to actively reduce the number of people requesting a test who should be getting one, without actually increasing the number of tests available. So what they're doing, and again, this may not be deliberate, it might be, but it might not. They're reducing the demand rather than increasing the supply. So is there any hope at all? I mean, I'd say it was optimism beyond me to expect that we will actually dodge any further bullets here. But there are a couple of things that could genuinely help. So first of all, the Chief Medical Officer has been pushing for a 2-week national lockdown to catch our breath, ease pressure on testing to allow it to expand to meet the demand. Now, I have no confidence that the same boobs who are making such a mess of testing will sort their act out, even with some respite. However, the strongest possible suggestion is that the government are going to announce this. Now, my main worry is that we are delaying it yet again. This was advised a week ago, and we're still only now thinking about it. The other thing is that Boris Johnson may have to water it down considerably due to pressure from his own MPs. We should be closing pubs and restaurants again. Now, we may do. I'm not going to say he's definitely not going to do that, but there is pressure not to do that. The Conservatives are much more in favour of just having them close at 10 o'clock. We're hearing that compromise going, oh, well, we'll close them at 10 p.m. as if that's some sort of compromise. So we'll just have them open from 5 a.m. in the morning till 10 p.m. at night. That's fine, isn't it? And now, given that the Conservatives, both in Parliament and the media, were consistently opposed to the original lockdown, when we also had a sky-high death rate, and there is known to be serious pressure within Cabinet itself for Boris Johnson not to enforce a genuine lockdown. To borrow a phrase, what they want is a lockdown in name only. I would say that it's iffy whether we will actually have serious measures to give us that respite. The second thing that might help, and this is not something I'm hearing from public health experts, it's just something I've bounced around in my own head and I've seen a couple of other people saying, is so if many of us, potentially not enough, but if many of us are in the habit of wearing face masks when we're around others and observing social distancing, then the prospect for the usual autumn and winter bugs to propagate is likely to be reduced. So we might actually blunt the spread of other infections that would heap that extra pressure on the NHS as an indirect consequence of our measures to avoid coronavirus. Now, that can only help manage the situation at a time when the NHS is going to start to be put under more pressure due to seasonal flu and other conditions as well. That being said, we have to remember why it is that these bugs spread so easily in autumn and winter. It's not because that's when they come out to play and they're hibernating all summer. It's because it's colder and people tend to stay indoors when meeting people and tend to be closer to other people for longer during autumn and winter. And despite government rules against this, again, it's very likely that given that it's an unpoliceable rule, that a lot of people who have already lost confidence with the government will just go, well, we want our dinner party. And on a final point, like I've talked about the lockdown here, I do hear that Boris Johnson will be addressing the nation this week. Now, that shouldn't be surprising. I mean, there were people in Scotland going, yeah, we hear from Nicola Sturgeon every day. Boris Johnson, we do not hear from him every day or even every week. So, you know, although he should be addressing us every day, it shouldn't be an uncommon event in the middle of an emergency. I'm not saying he has to talk to us every day in normal times. It is an unusual event. It is uncommon. So we have to assume it's to announce something major. And it's quite likely from reports that that major thing is going to be this national lockdown, this national measure, as they will call it. Whether it's an actual lockdown, we will have to wait and see. I strongly suspect it's been announced now in the media, but not to the nation for a few more days, specifically to test the waters. I think this is a classic case of, right, I know I need to do this, but I don't want it blowing up in my face and having to make another U-turn. So we'll just let a few reports go out, see how the media react to it, see how the public react to it, see how my own MPs react to it in a way that I can always deny was ever an announcement in the first place, and then I'll go from there. I think this lockdown is going to be based not on the medical advice, but on how his MPs and the media react to it. But anyway, those are my thoughts. Let me know yours in the comments below. I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.